Before watching our video, don't forget to hit like and subscribe for more videos like this. The Shoulder Apprehension Test is generally used to test the integrity of the glenohumeral joint capsule, or to assess glenohumeral instability in an anterior direction. The Shoulder Apprehension Test is performed using specific steps to evaluate the stability and potential risk of shoulder dislocation. To use our free Shoulder Apprehension Test, follow these steps. Download our Shoulder Apprehension Test from the Carepatron platform, which you can find in the link in the description. Firstly, positioning. The patient lies down on the examination table, typically in a supine or semi-supine position. Preparation. The healthcare provider ensures the patient is relaxed and comfortable before the test. Arm placement. The affected arm is explicitly positioned to assess shoulder stability. The provider typically holds the patient's wrist with one hand while supporting the back of the shoulder with the other. Abduction. The healthcare provider gently moves the patient's arm away from the body, commonly known as abduction. This movement places stress on the anterior structures of the shoulder. External rotation. While maintaining the arm in the abducted position, the provider externally rotates the arm. This involves turning the forearm and hand outward away from the body. Observation. As the test is performed, the healthcare provider closely observes the patient's response. They pay attention to any signs of apprehension, fear, discomfort, or pain experienced by the patient. Apprehension assessment. If the patient demonstrates signs of apprehension such as facial expressions of distress, attempts to resist or guard against the movement, or verbalization of discomfort, it suggests a positive result. Follow-up examination. A positive shoulder apprehension test result typically warrants further investigation. The healthcare provider may conduct additional tests such as imaging studies or a comprehensive physical examination to assess the exact nature and extent of the shoulder condition. Here is a sample of our shoulder apprehension test, which you can find on our Carepatron platform. To find our shoulder apprehension test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.